So I think there's a couple of reasons that Duchenne has a lot of interest. We've got a really strong advocacy community. Pat Furlong and PPMD really put Duchenne on the map in terms of years and years and years ago getting NIH interested and lobbying on the Hill. And I also think that with the first clinical trials that were successful and the first drug approval, I think we really blazed the way for other companies to become interested. I think once you have a first drug and they show that the disease can be modified, that you can change the outcomes, and that it's a very active community, physicians and clinicians are interested, more conferences pop up, you know, the word Duchenne is heard everywhere. I think biotech companies get very interested when there's proof that the disease can be modified. And so I think that's sort of where the interest is coming from. The community was also incredibly supportive of approval, and that helps with these small rare disease companies. If they can really engage rare disease community, they get the support that they need. So I think it's all of those things. I think we're also really loud. We have a lot of opinionated, loud leaders in our community. You know, one of the issues we're facing sort of forward-looking in rare disease and with Duchenne is payer issues and reimbursement. And so if I were speaking to folks who want to get involved in advocacy now or who just started having therapies in clinical trials, I would say that start looking now at your payer climate and looking at designing your clinical trials with reimbursement in mind. Start talking to state Medicaid boards, start talking to commercial payers about what they're going to require, because they're being, you know, it's great that the climate at the FDA is so welcoming to new drug therapies and faster approvals, but what it does is it lets payers have an out as far as coverage goes, because they start calling these therapies experimental. And so accelerated approval is going to be a reason to not cover these drugs. And so I would say to the broader rare disease community, get together on this and work on it and handle it, and from the top down. You know, we really have to start getting on top of the healthcare, because these new treatments, we're all so interested in the science, but nothing is any good if we don't have access. And so I'm a huge proponent of preparing and making sure that every patient has access to these therapies that are coming out. It's useless if not.